Greetings, New Zealand naturopath Eric Backer, author of Candida Crusher and formulator of CanXida, the Candida dietary supplements. Thanks for tuning in. Doing another case today. Case number 23. This is going to be a guy called Jeremy, a 26-year-old guy called Jeremy. Jeremy's not his real name, so I tend to disguise patients' names and ages. They're very real cases. I mean, I see plenty of patients. Here's some of my case notes from patients from last week. And so I do protect my patients' privacy, and I'm very much into privacy and confidentiality. So we'll just call this guy Jeremy, 26-year-old guy. And Jeremy actually, in fact, is presented with quite a lot of different problems. Jeremy's coming with asthma, eczema, and bad candida, bad yeast infection. Now, Jeremy's had a lot of problems growing up, really, with eczema and asthma as a child. And was put on lots of different antibiotics for throat and ear infections, and as a young child went on to all kinds of different medications for asthma, steroid inhalers, preventatives, also Salbutamol or Ventolin. I've had many patients placed on these drugs. I've seen them for many years, and eventually they become dependent on them. Their airways become dependent on these drugs to allow them to breathe properly. They develop a lot of anxiety around asthma, particularly the bad asthmatics. And of course they have multiple food allergies, and they end up with infections, so they take lots of antibiotics, they get sick, and of course then they get yeast infections. It's just one big mess. It's a big filthy drug spiral. So this poor guy, he's actually a healthcare professional. He's also drinking quite a substantial amount of alcohol. So I've got a food allergy test of Jeremy here. I've just covered up the top so you can't really see any details of the patient. You can actually see there all the lines, going right out there in the yellow zone. So this is a US biotech food allergy report, and all those lines signify quite a lot of food allergies. Dairy allergies, we've got egg allergies, we've got citrus allergies. If we look on the other side, it's just as bad here. Look at all the grain and legume allergies this guy's got. It's incredible here. You can see there are massive amounts of allergies there. If we go to the other side here, you've got a huge big garlic allergy there. So when patients become dependent on medications, and particularly if they drink booze on top of antibiotics and pharmaceutical drugs, they get a lot of leaky gut. They get a lot of permeability of the small intestine, which makes them very reactive to foods. So the first aim with Jeremy is to make him understand that the alcohol is only wrecking him. So if he can't really give up the booze for a while so he can repair the leaky gut, we're wasting our time. Now, your clear indication here of this guy with massive grain allergies. Now, have a look at this. You can see here all the allergies towards all the different grains. Now, it's, you'd be quick to assume that he's got gluten problems, that he's got, that he needs to go on these paleo kind of diets away from more grains, like a lot of people believe. But this guy's drinking spirits all the time. He's drinking beer all the time. He's taking antibiotics. So he really needs to get off these kinds of medications and this kind of lifestyle if he wants to repair the gut that's going to help his immune system. So, you'd have to be crazy to continue on with this kind of lifestyle. So that's my main focus with Jeremy, is to do that. And of course to work on the yeast infection. So he's been looking at my book. We've put him on the CanXida, removed the antifungal product I developed. We're getting already some early indications of a turnaround of this case. I'll repeat the food allergy report probably in 6 months and have a look at the gut function to see what kind of allergens are still present, but I suspect there'll be a lot less than there are today. So what you can take from this case is that if you have been diagnosed with asthma, eczema, you're taking antihistamines, all those drugs, you're drinking booze, you're taking antibiotics, you need to make changes if you want to improve your immune function. Particularly, you need to improve your gut function. That's the core thing I want you to get out of this. With improved gut function comes improved immune function. The diet, you don't have to avoid gluten and wheat and egg all your life. And eventually, Jeremy will be able to enjoy all those things again back in his diet. He just has to pull his head in and make changes. And that's this case. So thanks for tuning in.